Hey, happy Thanksgiving for those of you who watch this as soon as it is uploaded. Tomorrow's Thanksgiving, and tomorrow is also 6 months since my spinal fusion surgery. Before my surgery, I watched a lot of videos on YouTube, and I really learned a lot, but I was also misled by a lot because I didn't understand a lot of things. When people speak of having a spinal fusion, there's different types of spinal fusions, and it depends on how big their fusion is as to how well they do. Mine was huge, and I didn't realize it until after the fact. So I had listened to people who had maybe fused a couple vertebrae, and they were out doing so much better than I was after 2 weeks and stuff. And I went to my doctor's office on my first follow-up and was told, no, that's not the case. So I just want to say my fusion was huge. So if yours is not huge, you can't really compare it to mine. If yours is big, it can. Mine is actually from T11 to S1. I think that's about 8 or 9 vertebrae. I had 18 screws, 2 rods, and 1 plate. I was cut all the way up the front and in the back. 6 months later. Well, for the first month, or maybe even month and a half, I was having a lot of pain, and I had a lot of complications. I still have complications as far as nerve damage. I part of my body, like around my waist and my back, is numb. The skin is numb to pain or temperature. My thigh, my right thigh, almost the whole thigh except for the very back of it, is numb. It also feels very heavy, and I wonder if that's the cause of some falls I've had. So I had a fall just a few weeks ago, which was pretty scary because I didn't even know how to get up off the ground at that point with my new hardware back there. So I have learned how to do that now. Takes a lot of leg strength. The first 6 weeks, I'd say, I really thought maybe I'd made a mistake by having the surgery. The reason I had my surgery was because of scoliosis. My scoliosis was 40 degrees, and my husband said it looked like my spine was pregnant. So let's go to now. I've been through physical therapy once. I'm going back now, trying to work on the nerve damage and my balance a little bit. I feel a little uneasy when I walk, and I'm not sure if that's because of the fall or if there is a little bit of unstableness or dizziness. I feel lopsided because of that weight. It feels my leg is heavier. And my primary care physician believes that the reason I had such a like it looked like a swelling or something on my side was that the nerves in that muscle were not working, so the muscle has just collapsed. So that's kind of flopped over, and the other leg is heavy, and so I feel out of balance. I did recently have blood work, and praise the Lord, I'm no longer pre-diabetic. They did come back with a few things, and I think those things, they've got me on medication now to kind of correct those levels. And I think that's going to help with my energy level. I'm already, it's just been not even a week since I started the medication and supplements. And I believe that that is going to help with my energy, because I have had such low energy ever since surgery. And that was one reason I was thinking I was not getting better. As far as movement and everything, pain, sometimes I hurt at night. And I think maybe it's from the day's activities and you're laying down, but it's hard to get comfortable at night sometimes. I still have a little bit of restless leg syndrome, but I think what my doctor has me doing is taking care of probably 90% of that. Let's see what else. I did find caffeine, even early morning caffeine is affecting that restless leg syndrome. And let's see. I am just in such a better place now than I was last year at Thanksgiving. Last year, because of the pain I was in, I could barely go from my bed to the recliner. And when I did that, I was in a horrific pain. Just getting up every morning, I was so stiff. I get a little stiffness now when I sit and when I lay down. So sitting and laying down are not good for me. So I feel best when I'm moving around. So I'm just so happy. Today I was able to go out shopping with my husband. Yesterday, I think it was, or the day before, I was able to put up some Christmas decorations. And I wasn't able to do any of that last year. Like I said, just from the bed to the recliner, bed to the bathroom was just very hard. And hardly anything was helping, except for your prayers. And I do want to thank all of you all who had been praying. Of course, I wasn't here on YouTube then, but hopefully my folks from Facebook will be watching this. And if you are going to have this surgery, do ask a lot of questions, because I will say this, they don't tell you everything you're going to go through. And there are some pretty horrific complications you can come out with that aren't the really bad ones. Thankfully, some of those don't last for a while, though. But I'm just really happy where I'm at. I'm getting better and better. And I've noticed that everybody was right. It's going to take a long time. And I'm sure when I come back in here in 9 months to a year, I will tell you the same thing. I'm even better than I was at 6 months. I'm sure I'll be able to tell you that. So thanks for your prayers. And I hope this helps. This kind of just updates all my friends and everyone, but also I hope this helps somebody who is having or has had or is planning to have a spinal fusion or a spinal reconstruction for scoliosis. So you have a blessed day and take care. Be blessed. God bless you.